And like so many physicians and providers today, I was fed up enough to leave my full-time job. Scared the crap out of my husband, but it was time to go about it on my own, and I did have his full support. He says, he will tell you, he's like, something just kept my mouth shut to say, like, let her do this. This needs to happen. And but he said I was scared to death. But my patients got better faster, and it wasn't because I was good or great. I had time to listen. And I had time to treat their condition specifically for the needs that they needed or that they had, and nothing was overlooked. So we added functional medicine, so like nutrition type services, gut health, complex, weight and autoimmune conditions. But so many of these like complex patients, right? Everybody's like a complex case, right? So many of them could be well served with primary care. And that's what we just kept coming back to. It was like, if they just had a good primary care physician, a lot of this would clear up. And so, they needed somebody watching their labs, talking about sleep, talking about diet, nutrition. Everybody was worried about fasting and keto and all these things. But they needed that relationship, with somebody that they trusted. So we decided if we were to get to the root cause of promoting wellness, we knew we couldn't fix it in the current broken system. So our fee-for-service model, right, our healthcare system is currently built on volume and not value. And that's why we've ended up where we are. So that's why at least half of Americans do not have a primary care physician, or half of them admit to skipping going to the doctor, because of cost. They don't get enough time, or they're confused about how their benefits even work. So thankfully, Aaron at the time was actually a member of a direct primary care practice in Cincinnati. Dr. Amy Meckley down there, who spearheads a lot of the movement in Cincinnati. And so as we discovered this, and I discovered what it was, found out that it was started by physicians themselves that wanted more time with their patients, and did not have any limitations. If somebody needed to be seen another time in the week, insurance wasn't dictating that they couldn't see them because they had high blood pressure and I want to see you again. And they could do that at an affordable price. So what is direct primary care? It's a monthly membership model that allows patients to have direct access to a primary care provider without insurance in the middle. So there are over 1,600 independent direct primary care practices in America, with over 20,000 providers serving 35 million patients, and that is doubling every 2.5 years. It's expected to be as much as 30% of primary care by 2030. So why is this so groundbreaking? It's just primary care, right? We've always had primary care, but it's healthcare the way that it should be, okay? And it's time for you to hear about it directly from our patients, okay? So I'd like to call up Charles Johnston. Yeah, Johnson, so come on up. Yeah.
So I don't have any prepared remarks, but I'm very happy that you're here. I think this is an important topic, and Dr. Marino hit everything nail on the head. My background is probably slightly different than a lot of others. I did 25 years in the Marine Corps. I retired this past December. So with that, I had, again, like Dr. Marino said, I had a lot of symptom care, right? The goal in military medicine is to bring you in, find out what's wrong with you, get you back, and get you back on the job. And they did a great job. However, as we know, like a lot of veterans, as they start to age out, myself included, you leave there with some unresolved, maybe fully unexplored medical conditions, and I had that as well. So thankfully, though, during my transition, I was able to get a job down at Collins Aerospace in Troy. Very happy to be there. They take great care of me. And Dr. Marino came down and did a presentation to us down there. That's the first time I had ever heard of direct primary care. And there was a gentleman in there that gave a testimony that really kind of hit home for me. And he went into the individual care that he was getting when they listened to his problems. They helped him develop a plan. They looked at his labs. They were as involved in his health maintenance as he was. And that's exactly what I was looking for. Through my time in the Marine Corps, outside of medicine, I was interested in maintaining peak physical conditioning. It helped with everything from the daily chores to promotion and advancement. And so, supplementation and vitamins and exercise and all that, I did it on my own. And what he said is they want to go on that journey with you, right? If your goal is to in my case, manage blood pressure, but still be in the gym, still, working on, physical fitness and things like that. They'll help you with a plan that will tailor it to you. And so I said, that sounds great. I signed up, I came over, and haven't even looked back. As a matter of fact, my wife had her first appointment last Friday, I believe. She got her labs done today, and she sent that in because, again, she has her own kind of things that, while TRICARE wanted to help and is there and does a great job, it's not directly taking care of the issues that she really wants it to take care of, right? Or rather, probably a better way to say it, there's not that dialogue that builds that understanding that she knows it's moving in the direction that she wants to go. So the other thing, though, with the health savings account and opening that up, I know that was one of the primary reasons that you came, sir, is I think that's phenomenal. I think that whatever you can do to fight to get that approved would be fantastic. When we transitioned and we kept everything the same for us because we didn't know any better. We went on to TRICARE Standard, and again, a fantastic program. But it directs us down to Wright-Patterson Air Force Base for all of our care. And that just became too cumbersome for us. So this November, we're looking to change over to TRICARE Select, and then take ownership through the direct primary care resources here, and then our own, the resources that we have available through the government, our own healthcare maintenance. So that's kind of, again, a little different than probably many others here, but I thought it was important enough to be here today to share that story with you, and just say that it's been a phenomenal resource for us. We love the service. We're super happy we found it. Had you not come down to Troy, that probably would never have happened. So right place at the right time, and then being able to take advantage has really benefited not only me, but my wife. And we're talking about getting all the kids involved as well. We have 4 children, just because it just makes it, you better understand the health care that you're getting, and you know that they're going after the root cause and not just the symptoms. And then your confidence in the medical care you're getting just skyrockets. So that's it. Yeah.
I have not paid a single person up here. What's that?
So they're paying you?
Yeah, that's right. So CC and Ryan Shellabarger, would you mind coming up to share?
So I'm a pastor at a church, northern Montgomery County, and my wife has been in the medical field for 31 years. And as we standard insurance from your little hospital, and the options are, okay, you go with this group of providers, it became cumbersome because my wife had a stroke back in 2019, young age, but couldn't find any reasons for it, and basically we're told, hey, you need to take this prescription. The protocol says take the prescription. It's like, but you got to understand, her numbers are not where the cholesterol medicine should put it. And so just a total frustration, quit taking it. Doctor was upset. She finally, we found
Danielle.
We found this
We
practice.
found Victorous, and we found
and it's
Danielle.
been phenomenal. I've had pain in my leg for years. Went to a surgeon. Went to my doctor, and basically was told, oh, well, that's just how it is with aging here. Take some medicine. Take ibuprofen. And that was the constant thing. And now with treatments with dry needling through Tracy and physical therapy, if it starts hurting again, I know the exercises to do. Stretches and stuff to make it happen. Never got that from your doctor. It was in and out in 10 minutes. Here, they take time with you, and it's amazing. Feel better.
Another thing with Tracy was I had migraines that they got worse after my stroke, and we couldn't figure out. They were like, oh, it's because you had the stroke. You're just going to have to take some Tylenol, take some ibuprofen. Again, here's a pill. Here's another pill. Here's a pill for this. And we came here, and Tracy's like, man, your neck is so tight. Dry needling about 3 times. And I come back maybe every 6 months and go, Tracy, you got to help me. I called on a Friday. She was out because she had some issues. And the next thing I know, Laura's calling me. She goes, can you be there on Saturday morning at 8 o'clock? Angie does dry needling. And I'm like, 8 o'clock on a Saturday morning, they're not even open. And luckily I had done Ryan had helped me rub my neck, and we knew the knot where it forms because they had showed us. And I texted Angie at 7:30 Saturday morning, you can stay in bed. I'm not coming. I'm good. So these guys they've changed us. Our daughter, she was having some issues, and she's no longer a pediatric. So we're like, what do we do? Okay, well, this is where we're going. We trust them. And that's huge for me, you know. Sure. I see patients every day, and I'm like, you have to trust the person that's taking care of you. And they have our absolute trust. Absolute.
Thank you guys. Okay, Father Gabet from Holy Family Parish.
Thank you.
Yeah.
Congressman Jordan, my sister Annette from Fort Wayne, Indiana, I told her I was going to see you today. She said, be sure to tell them hi. So you're well loved not only in Ohio, but in Indiana too. So keep up the great work.
We'll have to get a picture.
All right, great. Okay. So what happened to me, I was during COVID, 2020, and I got in a car wreck. I broke up my knee and my hip, and so they took me in, and my insurance paid for that. I had a wonderful orthopedic surgeon. He did a great job. I had the hospital bed in my living room. Couldn't walk, of course, or couldn't even put pressure on it, and it seemed like forever, like 2 or 3 months. And I had a physical therapist, Jeremy, came to me, and he came down there, and he was an angel. He would, rub my leg, put the blue emu on it, and really worked everything out. And it was like, no pain for a while. So, yeah, we do have some wonderful medicine here in the United States, and we're very, very blessed with that. Some others have mentioned that too. But at the same time, he was there, and then the doctor finally gave me, it seemed like forever, but I finally was able to put pressure on as tolerated on my leg. And so all of a sudden, Jeremy, my physical therapist, became my physical terrorist. And I was a wrestler too, so I knew, like you, Coach, I was like, no gain, no pain, no gain, right? So he said, push it, push it, push it. And he did a great job. Even as my physical therapist, he was still an angel. So he helped me, and I did improve and everything like that. And then all of a sudden, boom, he tells me, sorry, your insurance is gone. It won't pay for anything else. I'm only 3/4 of the way there. And he said, hey, and he, such great physical therapists. I mean, they give them of themselves. And he said, I'd be happy, if you need me, I could come and say, I'm not going to do that to you, So it wouldn't pay for it, so the insurance was gone, and I'm only 3/4 of the way done. I still can't, I couldn't genuflect or anything like that, as we do quite a bit in church. That's kind of my job. Lisa, she came and she said, Father, I noticed that, you don't really genuflect, and then you don't kneel at the last prayer. The servers are there kneeling, the Leonine prayers, the end of the Mass and everything. She said, I know you should. I said, I can't do it. Well, I can help you. Oh, right. Thanks, Lisa. Thank you. It's just like, I'll get you a cake or something like that. All the ladies want to do that. It's like, And so, second time, Father, I could help you with that. Oh, yeah. Thanks, Lisa. Third time. Father, I'm going to be here Saturday at 2 o'clock. Are you going to be here? It's like, she's persistent, but very nice. She doesn't nag. Nick's a very,
I was going to say, tell that to Nick.
yeah, he knows. he knows. And so she came to my house and everything like that, and helped me with the exercise and everything. Her own, with pictures on it and everything like that. Some of us, need to see it, to the exercises and everything. And I improved quite a bit. Very much, and I was making really good progress. It hurt. Yeah. No pain, no gain. Yeah. But then she mentioned, she said, you might want to try dry needling. In some people it works. And so she said, Stacy does that. So I thought, okay, I'll give it a try, yes. So she put me, I was on the bench there, she was putting the needles in, and I didn't look. I'm not that tough anymore. But I wouldn't watch it and everything like that. But then she took it off and says, okay, let's see how you go. And I remember getting off the table. I said, well, let's see what happens. All the way to the ground, and right back up. Hey, how did that happen? So right like that, and then we did another part there, and then she told me, she says, well, you're done. I mean, look what you've done. This is great. So I don't need to see you over and over unless you want to. I like that, the possibility of doing that, but at the same time, you're actually curing me and getting me finished. So then I met Danielle Temple, my nurse practitioner, and she helps me. She calls me every 2 weeks to see how my blood glucose is and how my blood pressure is. And that, for me, it's encouraging. It's like a wrestling coach there, saying, hey, this is, you got to do better. You can do it. You can do it. Encouraging me. And so I found that, Victress has been a great help for me. I'm able to do things I couldn't do before. And, this is the way it should be, treating the cause instead of just the symptoms like that. So I'm very much for this, and I'm sold on Victress Health there then too. So I hope you will support it there too. And again, thank you very much, Congressman.
All right. Thanks. We just have a few minutes, so I'm going to have Ashley bring up her story. Ashley Holthaus.
Thank you, Congressman, for coming. And thank you. My name is Ashley Holthaus. I came here about 2.5 years, almost 2 years. But my kids were coming here. We have a family that let's just say they do everything opposite of medical. And my children, and so you were just getting treated the symptoms. And nobody was hitting the mark. And I've been a volunteer EMT for 21 years, and I knew what they're seeing, but they're not listening. So, of course, I took them here and got them, but then they finally said, when are you coming? I felt like all I was doing was working to pay medical bills. That's what I felt like I was doing. And so they saw me, but I saw Danielle a year and a half ago and just did a routine blood work. She said, let's just start at the basics. I got a call an hour and a half later. I was in full kidney failure. That was missed 2.5 years ago, or 2 years prior at my primary doctor. They didn't see it, didn't pay attention because I was just a number. I was just another patient that they just, oh, you're looking okay, go. I've had kidney issues since I was a kid, but nobody furthered on with it. So I was told right away I was in kidney failure. I need to get to the hospital because Danielle goes, the nurse practitioner, she goes, I don't know how long you've been in this. I had no symptoms. I went to the hospital, put on dialysis right away. I was told I had 6 months to live. Dialysis wasn't going to save me. This was August of 22, so obviously I have young children and I'm just trying to figure out what in the world is going to happen next. They did dialysis for 6 weeks. Every day I could text Danielle how I was feeling. She would respond within minutes, or I can email or I call. Laura answers and she's automatically, between Lisa helping, everybody was helpful. I could call at any given time. By the grace of God, I was given my kidney in January of 2023, last year, and by a non-donor. But since then, I'm still having complications from not my kidney, but the rest of my medical, because things that were missed when I was a kid, obviously as an adult, because I didn't go to the doctor because, well, I was already paying enough for my own children. So I just chose to just let mom go. I'll take care of everybody else. And they're like, no, we need to take care of you. So I'm still having complications. They can't figure out things, but they're not giving up on me. And so with Victress, it's just been a wonderful relationship because I can sit there, like I can text where my kids do something and have something randomly off the wall, which in my household we all do. They respond and say, okay, let's try this next. Found out my body is a slow metabolism. I don't break things down. So what that next means, I don't know, but they're not willing to give up. They're pushing to help my transplant team to further, because I went from my appointment for my year appointment, I think I saw the doctor for 2 minutes. And obviously that cost me an arm and a leg for just 2 minutes for him to walk in the door and say, okay, but I'm on steroids every day. I've gained a lot of weight from it. Nobody knows how to help me. And so with these guys, they're not willing to give up on me. So I say with Victress, with the direct primary care, that relationship of helping, trying to help, and obviously the spiritual side of things, so just that support, obviously when things are not going well. And, you know, not only with my job, what I do, but also just being able to share what they do here, just that love and compassion of not letting you just be another person or another number and just out the door just because, well, we got the money, we got the insurance, we're good. They're willing to help no matter what. So with that, they're still willing to help, even though, you know, my transplant's over with and I don't have to be seen all the time, but Danielle checks in with me all the time. And same with Lisa and Laura. I'll call, she'll ask me the first thing, how are you doing? I'm not calling for myself. Normally I try not to, but, you know, sometimes I have to. But with that, with my kids, it's been a help. My son, who has asthma, who's had it his whole life, he's controlled for the first time. He's in high school. He's able to play sports without any actual physical limitations. And that's been the first ever in his 15 years. So that's just been a blessing. And my daughter, she just has more control of that anxiety and stuff like that. And Danielle and them have given her tips because she's 13 and she's a teenager and everywhere. So just that support, I just truly appreciate all that they have done. But without them, I don't think I would ever known that I was in kidney failure and had no symptoms, and I probably wouldn't be here today. So thank you.
Thank you so much, Ashley. Whew, story's always chilling for me, so we appreciate you coming up here. Next, I would like to bring up Scott Hardings with Industrial Recyclers. So we also, go ahead.
First of all, when Lisa asked me to come up in front of all of you and talk, I did it because I just wanted to say thank you for what you stand for. Most importantly, okay? The pro-life and just pro-business. So I'm president at Industrial Recyclers, and I've been there 2 years. Prior to that, I worked at Whirlpool for quite a long time. With a large employer, you have a lot of options, affordable options with healthcare. In a small business that I work for now, we have about 40 employees here in Sydney, and we have another about 50 in Indiana. We could not find affordable options, okay? So we've been down this path with traditional insurance in a small business. It might cost us a couple $1,000s a person per month, and it might cost the individual $1,000, $2,000 a month, and some of these guys are only making 18, 20 bucks an hour. So basically, the majority of our workforce went without healthcare. It was just basically they avoided going until it was a crisis. So we were looking for an option that we could give our employees somewhere to go for some early diagnosis of issues, and even if it was something that maybe happened during the workday, they could come over and get a quick check for, say, a back injury or a knee issue or something like that. And it's worked out extremely well for us. We offer that in combination with either insurance or with something called Sedera, which is a program that allows the employee to have a option for a life event, like say cancer, or say you have an accident, because you have to be able to take care of your day-to-day needs, which is what you offer, I think. But you also have to have an option that takes care of a big need, which is like a cancer event. There is not good options out there. Most people only know about insurance. And I'm not a fan of government-funded much of anything, and government-funded healthcare does not work, okay? So we've got to find an option. I don't think we found that option yet, but I think the direct primary care is an avenue to get your day-to-day needs met in advance. You guys told some good stories, to get employees and us Americans to embrace taking care of our basic needs and having choices. And the other nice thing I guess I'll leave you with is I had a child about 10 years ago diagnosed with Marfan syndrome. So all my kids had to have check for Marfan syndrome. They weren't allowed to play sports. I had a brother that played at Penn State. Didn't they win the wrestling championship this year? I think Wisconsin did.
15 times in the last 15 years.
Yeah, that's crazy. So they're very good in wrestling. They won it again this year. My brother played there. Anyways, I got kids that play athletics. They couldn't play. They wouldn't let them play unless they went and got an MRI to check their heart. And it was $2,000 a person for that MRI. It's ridiculous because I didn't have good insurance at the time. What they offer here is options to say, let us help you find a place that's affordable. And I think the last MRI we had done was $500 because they were help us find. So that's consumer choices. Having consumer choices, like when you go to a grocery store and you can pay, I like to drink beer, so I can pay $30 for a 12-pack of a beer, or I can pay $10. Have choices. In healthcare, you don't have options a lot of times. You just show up at the emergency room and pray to God you can afford it. And I think that's what I'm looking for our employees, and that's what I'm looking for as far as myself. I've got 7 kids, my wife, so I have choices for my family, and that's what we're working towards as a business. So we've connected with Victor's here to provide that day-to-day. We've connected with Sedera for the longer-term events, and we're trying to find something that's affordable for the company and affordable for the employee. So I would just close with, if we could connect that somehow with a health savings
Is that high
account.
deductible? Is it pretty high deductible, the big event
Yeah,
insurance?
yeah, it is, yeah. Yeah.
That's what you're going for?
Yeah, so you're trying to get your day-to-day with your, something that's not gonna cause you to go bankrupt,
Right.
basically.
Right.
Yeah, you're exactly right. So if we could connect that somehow with a health savings account, I think that'd be tremendous, amazing, to be able to provide that, even a little more affordable. Make sense?
Total.
All right, thank you.
So Scott, you led right into our solution, which I will introduce you to Christina afterwards. Stephen and I had already been talking, but I'm now going to bring up Christina King with C&A Benefits out of Dublin, because she does have solution on the benefit side of things for employers. So come on
I was
up.
on the edge of my seat and I was like, oh gosh, I hope you're leading up to this. I'm Christina King. I'm founder and president of C&A Benefits Group. I've been in employee benefits for over, I'm just going to stop at 20 years. But 7 years ago, I was sitting at a conference and I was like, how have I been in business this long and not known this? And so we cracked the code with Victress. I'm sorry, I got something in my throat. With the Victress. So we build major medical plans around direct primary care. And we're saving employers $2,000 per employee per year and eliminating deductibles, $0 deductibles, $0 copays. We use local, thank you. We use local partners like direct primary care, the local pharmacies. We've built the community health plan in Logan County, and we're building it out here in Shelby County. So the city, so there's a way to do this. There's a way to build major medical, keep the big insurers out of here, and use direct primary care as the foundation of the health plan. And that's why we need the HSA monies. City of Bellefontaine, our plan in Logan County, because of direct primary care in Logan County as well as here in Shelby, they're up for Health Plan of the Year at Health Rosetta. So the best health plans in America. That's what we're building locally with local partners. So thank you.
I know we don't have too much more time, so what solutions do we have, right? So number one is reaching the employers, and that's what we are, boots on the ground, working our tails off. I encourage you to pester your boss, your broker, your community leaders, whatever it takes, that there are solutions out there, okay? You don't just have to accept, we call them the BUCA plans because it's Blue Cross and United and Cigna and Aetna and Humana, right? So you have options. So we're working hard here locally to make this possible for our small businesses and for our municipalities. I mean, this is the city of Bellefontaine, right? And then number two is for our families to be able to access those HSA dollars, to be able to get access to direct primary care through monies that they already have, okay? And so just so everybody knows, so House Bill 5688 was introduced last fall by Representative Lloyd Smucker out of Pennsylvania. It was reviewed by the House Committee on Ways and Means, and is currently number 330 on the union calendar, which I'll need you to explain to me what are we like that's just never going to happen, or are we
Doesn't matter where it is on the calendar, it just matters if it's going to get brought to the floor.
Okay, so that's where your help comes in, Congressman Jordan, telling your colleagues all about this. We hope we've just made a lasting impression on you, to really bring faces to mind of like who this really matters, life or death situations. So my question is these big BUCA plans that we talk about, Blue Cross Blue Shield, Aetna, Cigna, they spend $1 for every 6 that they earn on lobbying. How do we overcome the financial influence that they have?
Yeah, I think this production you just had right here is exactly right, hearing from real people talking to their members of Congress. So I assume is there an association that you have where you have primary care, the same kind of practices around the country that you're involved
Yes.
in?
Mm-hmm.
Yeah.
Yep.
So that's where you do it. Bring regular people
Yeah.
into Washington to talk to their member, and they can hear the same kind of stories we just heard
Absolutely.
here today.
All right, very good. If I don't know if you want to stand or you don't want to stand. So what have you heard any rebuttals? Do you hear? Are you hearing any? That'll never work. That's not a solution about direct primary care or.
I would just say this is patient-centered.
Yeah.
Just like in education, you want child-centered education, student-centered education. Same thing in healthcare. You want patient-centered healthcare. That's what you're doing, working directly with the patient to help them in a holistic way. And it's like free market. It's
Yeah.
like I used to say the only place left in healthcare where it's still free market's dental care. But it's not just that, it's what you're doing as well. But most of the rest of healthcare is driven totally by the government and the big insurance companies. So you want this kind of model that empowers the patient and access to health savings account money so they can spend it with the person they trust who, like you and your sister, are providing the care that they know is benefiting them and their family. So yeah, I'm all for it. My biggest problem is I'm just not on the committees that deal with healthcare. I'm on the Judiciary Committee and the Oversight Committee where we go after government who's doing bad things to you in other ways. So, yeah, government doesn't do much good. So, yeah, but I'm glad. I know Lloyd, the sponsor of the bill, Mr. Smucker, good man, good conservative guy who's also, by the way, very concerned about our budget situation, the deficits we run each year and the debt we're carrying, $33 trillion debt we're carrying now. So he's looking at it from patient wellness, patient care,
Yep.
and what it means to the debt situation. Because as you pointed out, I think your opening sentence was the biggest costs to the government are what we do in Medicare, Medicaid, and healthcare dollars. So this makes all the sense in the world, and I'll try to be helpful.
Sure.
It's just the Ways and Means Committee is the committee where this stuff happens.
Right. Yeah, it's something like $4 trillion that is spent in healthcare, and the studies are showing that direct primary care, along with direct contracting, can save 20%. And so that's $800 billion.
Yeah. Better
like-
results and less money.
Right, and so like.
Shazam!
60
Who wouldn't want that, right?
Yeah, exactly. We knocked that budget down in 60 years. So, any other solutions that you would propose to help gain traction on direct primary care at the state, local, national levels?
Well, just do what you're doing. Communicate with people. It doesn't hurt to talk to. Our state senator over here is a pretty important one, Senator Huffman. Talk to the folks on the state level too, because they can pressure the federal government to embrace concepts that actually work.
Yeah.
So yeah, it's getting the ear of the people who make the policy is
Sure.
is important.
Sure.
And
Yeah.
that's why he took time and all these people come out to talk to that knucklehead guy
That's
from
right.
Champaign County who represents.
Yeah.
So
Well,
I appreciate you doing it.
Yeah, my mom's a gym teacher, and she was a gym teacher for Senator Huffman's kids.
Oh, okay.
So,
Yeah.
Pretty sure we still got it. Though.
Yeah.
Yeah.
Talk to Matt.
Yeah,
I'm gonna be
he's-
visit with Matt tomorrow. He's a
Team
good,
doctor
great
down
guy.
at CJ, so we appreciate that.
Could I ask
CJ,
a question?
Sure.
Yeah.
Who would, if we were to contact, because I know a lot of times contacting the congressmen that are on the committees,
Yeah.
the noisier, the squeaky wheel
Yeah.
gets the grease, who would be the people that, we could be emailing and contacting
Well, the one that matters the most is the chairman. So Chairman Smith, Jason Smith, is a good member from Missouri, chairs the Ways and Means Committee. Historically, obviously one of the most powerful committees in Congress. They deal with tax because they deal with tax policy. But they also deal with all the government health care programs. So Jason's the key guy.
Okay.
Yeah, key guy. But I don't want to get too political because that's not. But we've got a big election coming in 5.5 months, and if there's one party more inclined to empower patients and go with health savings accounts, medical savings accounts, than the other party. So elections, the old line, elections have consequences. So this is an important one coming up.
All right, very good. Our prayers are with you for sure.
Well, we need that.
Yes. I know you have to get going, so thank you so
Thank
much
you.
for being here today.
Doctor, thank you.
So,
You
yeah,
bet. You bet.
absolutely. So,
Step out
yeah.
this way here.
Yeah.
Thank you.